So today we will be discussing about fat and marrow embolism. In this type of embolism, the particle which gets occluded in the arteries are generally fat and sometimes associated with marrow particles also. So what is fat and marrow embolism? It is microscopic fat globules, sometimes which are also associated with bone marrow, are deposited and are found in pulmonary vasculature. So, why do these fat and hematopoietic stem cells and bone marrow are formed? It is generally because of the fracture of long bones or after vigorous cardiopulmonary resuscitation in which there are chances of fracture of ribs. So, if we see a bone, it has some blood vessels and bone marrow inside it. So, when this bone gets fractured, there is all these bone marrow and fat droplets come out in the bloodstream and travel just like in pulmonary embolism and get deposited in the pulmonary vasculature. So, generally, it does not have any clinical consequences. It has been found that in 90% of skeletal injury patients, there is fat and marrow embolism, but only 10% of them have clinical findings. So those 10% which have these clinical findings are known as fat embolism syndrome. This is the clinical symptoms of fat embolism syndrome. There is pulmonary insufficiency, neurological symptoms, anemia, and thrombocytopenia. So pulmonary insufficiency can be seen by sudden onset of tachypnea, dyspnea, and tachycardia. Neurological symptoms include irritability, restlessness, delirium or coma, and thrombocytopenia is due to platelet adhesion to fat. So there are fat molecules, there are platelets lying inside the blood vessel. So platelets get adhered to fat molecules and this leads to thrombocytopenia. Then anemia is due to aggregation of RBC and hemolysis of RBCs. So we see pulmonary insufficiency, neurological symptoms, anemia, and thrombocytopenia. And the patient will of fat embolism syndrome will present with tachypnea, dyspnea, tachycardia. He will be having thrombocytopenia, hemolysis, and must be having a history of skeletal injury. See in this diagram, here are the fat particles which I highlighted here, and these are the hematopoietic stem cells. All these have occluded the blood vessel as written here, the bone marrow embolus in the pulmonary circulation. These are fat molecules, these vacuoles, and these are hematopoietic stem cells from the bone marrow. So, what is the pathogenesis of fat and air embolism? So, as you can see here, there is mechanical obstruction and biochemical injury. In mechanical obstruction, there is obstruction of the blood vessel and formation of occlusion inside the lumen of the vessel due to fat and marrow particles, platelet, and RBC aggregate. So, fat, platelet, and RBC aggregate are found inside the lumen, and this leads to mechanical obstruction of the vessel. However, this does not cause major symptoms. The major symptoms are due to the chemical reactions which occur in case of embolism due to fat because there is release of fatty acid from fat globules and this leads to toxic injury to the endothelium, platelet activation, and all these causes vascular assault. And this is the main reason of the clinical symptoms of fat and marrow embolism. And this is what makes it different from pulmonary embolism. In pulmonary embolism, there is mainly mechanical obstruction. However, in Fat and marrow embolism, along with mechanical obstruction, which is the small part, the main reason for the clinical symptoms are the biochemical reactions which occur due to release of fatty acid from fat globules, which causes vascular assault due to toxic injuries to the endothelium. So this was about fat and marrow embolism. Now, next coming to amniotic fluid embolism. In this kind of embolism, the embolus comes from amniotic fluid and it enters the maternal circulation, and this generally happens during labor or delivery. And the main reason for this embolism is tear in the placental membrane or ruptured uterine vein. So generally squamous cells or keratin debris from the fetal skin are seen in the embolus, and this should be noted that this is the fifth most common cause of maternal mortality. As you can see in this diagram, there are pulmonary arterioles which have been occluded with squamous cells from the amniotic fluid. Now coming to what is seen in case of amniotic fluid embolism, this is we have seen that the fifth most common cause of maternal mortality and squamous cell and keratin debris are found in the vasculature. So the main reason of the symptoms are that these tissue from the amniotic fluid are thrombogenic in nature, and these thrombogenic nature leads to biochemical activation of coagulation factors, which leads to DIC and its symptoms. So the symptoms of amniotic fluid embolism are sudden severe dyspnea, cyanosis, and shock. There is also neurological impairment. These are the immediate symptoms. And if the mother survives all these symptoms, then there are chances of pulmonary edema and DIC, that is disseminated intravascular coagulation, which is because of the thrombogenic nature of amniotic fluid, which causes biochemical activation of coagulation factors as well as complement